As we age, many of us aspire to stay in our homes for as long as possible. This is often easier said than done, especially when it comes to maintaining health and safety in the home environment. But there are steps you can take that will help make aging in place more accessible and enjoyable. Aging in place means staying in your own home for as long as possible, and this has some definite pros and cons. Today we'll look at the benefits and challenges of aging in place, as well as some ways that you can prepare your home to support your needs as you age. We'll also discuss important considerations regarding safety and health that will ensure a comfortable lifestyle as you grow older. So let's get started. The top 3 benefits of aging in place include increased independence, reduced risk of health decline, and increased access to quality care. Let's break those down a little further. Increased independence. As we age, it's natural to desire more autonomy over our lives. After all, it's been part of the American dream for generations to own a home and live life on our own terms. Aging in place allows you to maintain control over your living situation and make decisions about how you want to live each day. It can be challenging to adapt to a new living environment, especially when moving to an assisted living facility or nursing home. You may have to adjust to a new set of rules and regulations, limited space, and less freedom to make choices about your daily life. However, by staying in your current home, you can continue to live life on your own terms, while still receiving the support and care you need to stay healthy and safe. Reduced risk of health decline. The benefits of aging in place don't stop at increased independence. Staying in your own home can also help you maintain your physical and mental health as you age. According to a study published in the Journal of the American Geriatric Society, people who stayed in their own homes were less likely to experience cognitive decline than those who moved to an assisted living facility. Additionally, the study found that those who aged in place had better overall health outcomes, including lower rates of falls, hospitalizations, and nursing home admissions. There are several reasons for these findings. First, people who age in place are more likely to have social support from family and friends in their community. Strong social connections are essential for maintaining good health and well-being. Second, aging in place allows individuals to maintain a sense of control over their lives, and this sense of control is associated with better health outcomes. Finally, people who age in place are more likely to be physically active because they are able to stay in their own homes, and exercise is essential for maintaining good health as we age. Increased access to quality care. One of the biggest challenges of aging is accessing quality health care, but aging in place can actually help seniors get the care they need without leaving their homes. That's because technology has made it easier than ever to receive remote medical care. For example, a study published in the Journal of the American Medical Informatics Association found that teledermatology, or the use of technology to diagnose and treat skin conditions, was effective for rural seniors. In fact, the study found that teledermatology was just as effective as in-person care for diagnosing skin cancer. What's more, teledermatology was associated with improved access to care for rural seniors, meaning that patients in remote areas no longer had to travel long distances to see a specialist. Other studies have also shown that telemedicine can improve access to care for other conditions such as diabetes, heart disease, and mental health disorders. Additionally, telemedicine has the potential to reduce healthcare costs by reducing the need for emergency room visits and hospitalizations. This is especially important for seniors who often have limited incomes. By using telemedicine, seniors can get the care they need without having to take on additional financial burdens. Overall, aging in place allows seniors to access quality care without leaving their homes, and this can improve health outcomes while reducing healthcare costs. Now that we've covered some of the benefits of aging in place, let's look at some of the potential downsides. While aging in place can be a great option for many seniors, it's not right for everyone. There are some potential downsides to consider before making a decision. The first downside is safety concerns. As we age, we may become more vulnerable to falls and other accidents. It can be difficult to maintain a safe living environment as we lose strength, balance, and vision. However, there are some steps you can take to make your home safer as you age. First, you can install grab bars in the bathroom and on stairs. Grab bars provide support and stability, which can help prevent falls. You can also install handrails on both sides of staircases to provide additional support. Next, you can make sure that your home is well lit to make it easier to see potential hazards. Motion sensor lights can be helpful, especially at night. You can also install brighter light bulbs throughout your home. Finally, you can remove tripping hazards such as rugs and cords. This will help you avoid falls and other accidents. By taking these simple precautions, you can make your home safer and more accessible as you age. Another potential downside to aging in place is the high cost of home maintenance. As our homes age with us, they may require more upkeep and repairs. This can be especially challenging if we're on a fixed income. However, there are some things you can do to mitigate the cost of home maintenance. First, you can make energy efficiency upgrades to your home. This can help lower your utility bills and free up more money for home repairs. You can also contact your local utility company to see if they offer any rebates or discounts on energy-efficient upgrades. Next, you can do regular maintenance on your home to prevent major issues from arising. This includes tasks such as cleaning gutters, inspecting roofs, and maintaining the lawn. By staying on top of these tasks, you can prevent small problems from turning into big, expensive ones. Finally, you can contact your local municipality to see if they offer any programs to help homeowners with repairs. Many cities and towns have programs specifically designed to help seniors make necessary repairs to their homes. By taking these steps, you can keep your home in good condition without breaking the bank. Social isolation is another potential downside of aging in place. As we age, it can be difficult to get out of the house, whether due to health concerns, mobility issues, or simply a lack of transportation. This can lead to social isolation, which can have negative effects on our mental and physical health. However, there are some things you can do to combat social isolation while aging in place. First, you can stay connected with friends and family through phone calls and video chat. Technology can help us stay connected with loved ones even when we're unable to see them in person. You can also join online communities or groups based on your interests. This can help you stay socially active and engaged. Additionally, you can volunteer your time to causes you care about. This can help you meet new people while making a difference in your community. Finally, you can contact your local senior center to see what activities and services they offer. Many senior centers offer transportation services to help seniors get to and from social events and appointments. They also often organize trips, outings, and other activities that can help seniors stay connected to their communities. In conclusion, aging in place can be a great option for many seniors, but it's important to weigh the potential downsides before making a decision. Safety concerns, high cost of home maintenance, and social isolation are all potential challenges. However, there are steps you can take to mitigate these risks and make aging in place a positive experience. By taking proactive steps to address these potential downsides, you can enjoy the benefits of aging in place while still ensuring your health, safety, and well-being. We hope you enjoyed this video and learned something new. If you're thinking about aging in place, we encourage you to reach out to a home care provider today. A home care provider can help you make your home safer and more accessible as you age. They can also provide companionship and support so you don't have to worry about things like grocery shopping or transportation. Aging in place doesn't have to be challenging. With the right resources and support, you can make it work for you. Thanks for watching.